but actually, you know what, I don't want you to, you're good. You're twice.
Are you sometimes late? Is that?
No, I'm prior military. I'm always early.
George Bush used to say late is early.
I think you're early.
Yeah, you ought to be 15 minutes early to any meeting you hold.
Thank you very much, everyone. Thank you. Following the release of our reopening guidelines, governors across the country are looking forward to phase one and announcing plans for an economic resurgence. We're going to have a resurgence, too. At a time when millions of American workers and families are struggling with the financial consequences of the virus, it's critical to continue the medical war while reopening the economy in a safe and responsible fashion. During this time, Americans must maintain strict vigilance and continue to practice careful hygiene, social distancing, and the other protective measures that we have outlined and that everybody's become very familiar with. We continue to be encouraged that many of the areas hardest hit by the virus appear to have turned the corner. For example, recent deaths are down very, very substantially. You can compare that with their peak not so long ago, and you have numbers of 30%, 25%. In Detroit, as an example, it's down by over 50%. Congratulations. And in New Orleans, where they've done a terrific job, they're down 65%. 30 states have just one case or less per 1,000 people, far fewer cases per capita, as an example, than Germany, the United Kingdom, France, Italy, Ireland, Switzerland, Singapore, Belgium, Spain, Norway, the Netherlands, Austria, Sweden. My administration continues to press Congress to replenish the enormously successful Paycheck Protection Program, which has impacted 30 million American jobs. We hope to have an agreement very soon, and hopefully tomorrow the Senate's going to be able to vote. A lot of progress has been made on that, tremendous progress. It's a great plan. It's a great plan. It's helped a lot of people. So we hope to have a vote maybe tomorrow in the Senate. And based on the record low price of oil that you've been seeing, it's at a level that's very interesting to a lot of people. We're filling up our national petroleum reserves, strategic, the strategic reserves. And the Netherlands, Austria, put as much as 75 million barrels into the reserves themselves. That would top it out. That would be first time in a long time it's been topped out. We'd get it for the right price. We're also pushing for the deal to include an additional 75 billion, our deal that we're talking about, $75 billion for hospitals and other healthcare providers. Many providers and their employees have taken a huge financial hit in recent weeks, and visits, elective procedures, surgeries, et cetera, were canceled. We think that they can all get back online. They'll get it done. The hospitals have really been fantastic. The hospitals, they've stepped up to the plate. They've really done a great job. We appreciate it so much. For areas less affected by the virus, we've issued new recommendations about how to safely resume elective treatments. HHS has also distributed the first $30 billion in direct payments to 1 million healthcare providers across, find additional testing capacity within their states. Many, many labs. We're providing you with a list. We'll show it to you now. If you need it, we'll give you the details. But hundreds and hundreds of labs are ready, willing, and able. Some of the governors, like, as an example, the governor from Maryland didn't really understand the list. He didn't understand too much about what was going on. So now I think he'll be able to do that. It's pretty simple. But they have tremendous capacity, and we hope to be able to help him out. We'll work with them and work with all of the governors. Similar to the situation with ventilators, states need to assess their complete inventory of available capacity. Some states have far more capacity than they actually understand, and it is a complex subject, but some of the governors didn't understand it. The governor, as an example, Pritzker from Illinois, did not understand his capacity. Not simply ask the federal government to provide unlimited support. I mean, you have to take the support where you have it, but we are there to stand with the governors and to help the governors, and that's what we're doing. And they have a tremendous capacity that we've already built up, and you'll be seeing that. We're going to be introducing a couple of the folks in a little while to talk about it. I want to draw your attention to Governor Cuomo's remarks during his press conference today. He said the president is right. The state's testing is up to the states to do, which will implement the tests and logistically coordinate the tests. We have about 300 labs in New York, and they're great labs, actually. And it's my job to coordinate those 300 labs. I think the president's right when he says that the states should lead, and the governor's they're really getting it together in New York. A lot of good things are happening in New York, and I think the governor's going to come in to see us tomorrow. He's coming to the Oval Office tomorrow afternoon. Andrew is going to be coming in with some of his people, so we look forward to that. Some of the articles that just recently came about, if you remember, and I put out a statement today, for a month it was all ventilator. That's all people could talk about was ventilators. And we did a great job with that. We built a lot of ventilators, to put it mildly. We have so many now that at some point soon we're going to be helping